TiNivo-2, we looked at patient-reported outcomes using questionnaires. This was a secondary endpoint. And just to assess in these different treatment arms, there was different dosages of the Tivozanib. And then, of course, one arm had a lower dose of Tivozanib at 0.89, but with the combination of Nivolumab. And then that was compared to Tivozanib at full dose, 1.34 milligrams. And so going from baseline and then measuring every day one of every cycle, the quality of life metrics remained stable throughout the treatment for both of these arms. So there was no difference, which was nice to see. No worrisome kind of safety signals in that combination treatment. But when we delved further in to try to understand, was there a subset of patients who maybe had differences in their quality of life or a trend, it looked like those patients who received, went onto this trial as kind of second-line therapy and received Tivozanib as second-line therapy, that maybe there was a better chance of having improvement in their quality of life scores and lower likelihood of having deterioration compared to those patients who received treatment in the third-line setting. And I think, that kind of makes sense to me as well when we see patients who are progressing on kind of sequential TKIs. I think the main one where we saw this trend was just, again, that kind of difference between looking at patients, whether they got it in the second line or third line setting, and no other differences based on other characteristics. I think it's always important for the physician to be informed and the patient to be informed. If we're, trying to balance that controlling disease, but also maintaining quality of life, I think that's super informative to have this data. So I was really pleased to see this data readout.